Hello everybody, my name is Raina Ogren and I'm the Chair of the Primary Care Diabetes Society of Australia. I'm a podiatrist and a researcher with a special interest in diabetes like all of you here today. Firstly, I'd like to acknowledge the traditional owners of the land on which we're meeting around the country. And in my case, I'm on the lands of the Wurundjeri peoples and I pay my respects to elders past and present. We also strive to reduce the impact of diabetes on Aboriginal and Torres Strait Islander people living in Australia. So thank you all for attending today's webinar, one of a series that Primary Care Diabetes Society is presenting in collaboration with the NADC. And today I'm delighted to introduce a session to build on our interprofessional collaborative care focus. And a key aspect of collaborative care is there needs to be good communication as well as access to information for teams to be able to work together. And so today this webinar will cover on the access component, talking about an existing tool, My Health Record, with Bianca Mayward. And so Brianna Mayward, sorry. Brianna is a digital health educator at the Australian Digital Health Agency. She has a background in public health and practice management with extensive experience in primary care development space across medical practices and PHMs throughout Queensland and New South Wales. In her role at the agency, she educates and supports healthcare providers across Australia in the meaningful use of digital health tools, including My Health Record and electronic prescribing. But before we go, we would like to do a couple of polls first. And for all of you who have seen my sessions before, I actually have a better idea on how these works, but bear with me. So the first poll is, are you connected to and using a My Health Record? So it's either yes, connected and using regularly, yes, connected, not using often, not connected and not using, or not sure. And I'll give you a few moments to answer the question. I'll just do another 5 seconds. Okay, 5. I'm going to end the poll now. There you go. And so the next one, and I don't know if we can see them, there are yes, connected and used regularly is 10%, yes, connected, not using often 42%, not connected and not using is 42%, and 5% is not sure. Now the next poll, Lay, I might need to get you to, here we are, thank you. Next poll is just a little bit for what is your discipline. So if you don't mind just popping in, this is much just so that we get a sense of who is on the session. So nurse practitioner, allied health, general practitioner, specialist, aged care provider, and practice manager. And again, I'll give you a few seconds. And another 5 seconds. All right. And I'm going to end the poll now. And Lay, I'm afraid I can't go back. Sorry about this. My lovely, exciting adventures. Thank you all. So there were 52% nurses, 4% nurse practitioner, 33% allied health, 4% general practitioner and 4% specialists. So thank you all and please remember, so we'll start the presentation now with Brianna. Please put any questions in the question and answer section in the side panel. Brianna can then answer them at the end. So welcome, Brianna.
Thank you so much, Raina, and thank you so much for having me. I'm really pleased to bring you this session today, as Raina said, on My Health Record and how it might be a useful tool to support you in accessing health information for people with diabetes. So I would like to also start with an acknowledgement. I'd like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them and their cultures and to elders past and present. And I'd like to acknowledge and extend that respect to any Aboriginal or Torres Strait Islander colleagues who may be joining us on the line today. So thank you so much for doing those polls. It was really interesting to see and get that insight into who we've got on the line today, as well as your current use or knowledge of My Health Record. So what we hope to do today is to cover what My Health Record is and its benefits. And for those of you who may be familiar with the system already, this might be a bit of a good refresher and an update on some recent enhancements that have kind of gone into the system. And for those of you who are maybe new to the system, this will hopefully give you a really great overview of who the key users are of My Health Record currently, as well as what is the key information that's held within My Health Record. We're going to cover how it can really support in getting better access to information and improving that coordination of care for people with diabetes. We're also going to touch on security, privacy, and some consumer controls that are in place, and identify how you can get further support and resources for using My Health Record. So as Raina said, please use the Q&A rather than the chat, because I'll be keeping an eye on that throughout the session. And if there are any questions sort of that come in along the way, I'll be keeping an eye on that, and I can maybe address those throughout. But we definitely will have some time at the end to go through and answer questions that I might not have got to throughout the session. Okay, so we'd like to begin with a bit of an overview of My Health Record. So My Health Record addresses Pillar 1 of the National Digital Health Strategy. The National Digital Health Strategy was co-designed with all Australian states and territories, and has 7 key strategy pillars. Now, the first one is all about improving access to health information, making that information available wherever and whenever it is needed. And that is where the My Health Record comes in. So it is an online secure summary of a person's key health information. So it's not designed to be a complete record of every single piece of health data for that patient. It's supposed to hold key and crucial health information about that person. It is not designed to replace any existing records, but it is there as a complementary source of information. So it is giving us access to key pieces of health information that we might not have otherwise had access to. Now, another key feature of the system is that it is personally controlled. So a person can choose if and when they interact with their own record, as well as they can manage what's in their record and who can access it. My Health Record is part of a national system, so it is available anywhere around Australia, 24 hours a day, 7 days a week, to any authorised healthcare professionals who are involved in a person's care. So this can really support us if we are seeing or supporting people where they may be transient, so moving between healthcare settings or moving between states and territories. This can support us if we are providing care to people who we are seeing for the first time, or who may have multiple other members of their healthcare team. So where we're not getting that information sent to us directly, this can allow us access to that information at the time we need it to support our patients at the time that they are with us. It's also protected. So there are multiple layers of best practice security in place, including end-to-end encryption, strong firewalls, audit logging and secure login processes, as well as a cybersecurity center that monitors the use of the system 24/7. There are also key pieces of legislation that underpin the security of the system, which includes the My Health Record Act and 2012 and the My Health Record Rule 2015. So My Health Record may be a useful tool for healthcare professionals who support people with diabetes, as you might often require information about your patients that you were not sent directly. So for example, medicines information about patients' other conditions or diagnoses, or recent health events such as, hospital discharge summaries. So being able to access this information directly through My Health Record at the time you need it can not only save in that administrative burden, but also improve the quality of care that you can provide to your patients. It's also important to note that My Health Record does not replace direct communication between healthcare providers. It is another complementary source of health information that you may not have been able to access previously. So let's have a look at how the system is currently being used. So here we can see that there are over 23.3 million My Health Records in Australia, which is around 9 in 10 Australians. So 9 out of 10 Australians have a My Health Record. Through the COVID-19 experience, there's been accelerated use of key digital health tools such as, a significant uptake in telehealth, electronic prescriptions are now available, and also the use of My Health Record has increased considerably during the pandemic. As a result, we are seeing improved use of the system and more useful clinical information actually being uploaded and viewed month by month. So how are healthcare providers using it? We can see here in terms of pharmacies, general practices, and public hospitals, the majority are connected and able to use My Health Record. We can also see that the specialist sector are increasingly coming on board, registering and starting to use the system. So we can see 22% of specialists have already registered and 10% actively using. There are also increasing numbers of private hospitals and pathology and diagnostic imaging providers that are becoming connected to the system and sharing information. The agency is also continuing to work with a lot of aged care and allied health sectors to increase the uptake and use of the system as well. So we are seeing month-to-month increases in the number of documents that are being viewed, which are uploaded, by those healthcare organisations. And this has a lot to do with the ongoing enhancements that are being made to the software products that allow that connection and have that My Health Record functionality. So that is, continuing to allow ease of use of the system in people's day-to-day workflows. So I can see a couple of comments have come through about sort of ease of use and whether or not it is sort of something that is being taken up by healthcare providers across the system. So I'm happy to address those. But these are the statistics currently, and absolutely we'll be sharing the slides following the session if you'd like to have a little bit of a deeper dive into these stats as well. So having a look at the current documents, at the moment there are over 629 million clinical documents, consumer and healthcare provider uploaded documents. Of those, there are 255 million clinical documents, and that includes documents from organisations such as our public and private hospitals, pathology and diagnostic imaging providers as well. In addition, there's over 373 million medicine documents. So that can be coming from our prescriber organisations as well as our dispensing organisations, so our pharmacies. And consumers can also upload documents into their own records. And we're seeing currently about 438,000 documents uploaded by consumers for their own records. So on the next slide, we're going to explore the different types of documents that are available in My Health Record in a little bit more detail. So the documents contained within My Health Record can be divided into three broad categories. They are the consumer documents, and these are uploaded by the person themselves, and they can do that, for example, as a personal health summary. A person can add information such as, medications, so things like vitamins and supplements that they're taking, or they can even include information about their own allergies or adverse reactions, and can also upload advanced care planning documents. Then there is Medicare sourced information. So the Medicare system also connects through to My Health Record. So this is where we're getting a lot of really useful data around the Medicare benefits schedule, or MBS data, as well as the pharmaceutical benefits scheme. So that's PBS claims information as well, we can see there. Also, the majority of documents, or the bulk of the information shared into My Health Record, is by healthcare providers or healthcare professionals. And these documents include things such as a shared health summary, which we'll go into in a little bit more detail, our discharge summaries, pathology and diagnostic imaging reports, and a great deal of medicines data as well. Now, the infographic in the center of the slide here shows some useful overviews that are available in My Health Record, such as the medicines information view and the pathology reports overview. Now, these are system-generated views that draw information from within a person's My Health Record, and it's displayed in a condensed view. So if you're maybe somebody that's accessed My Health Record quite some time ago, this might be a welcomed enhancement to the system, and these were designed to support healthcare professionals in saving time and accessing information very quickly. So all of that data from within various places in the patient's My Health Record is condensed and aggregated in each of these views for us, so that we can see all the information in one listed view, which is really, really handy. And I'll show you a look at a couple of those overviews in just a moment. So we know from having a look at this slide here that this can be a lot of really useful information, particularly if we didn't receive it directly as members of the patient's healthcare team. So when you're able to have timely access to a person's key health information, it can help in your clinical decision making. It is proven to reduce potential medication errors, decrease unnecessary duplication of testing, and support in overall coordination of care for patients. Now, also worth noting that there are enhancements sort of in the pipeline. So one of those is an aged care transfer summary document, which is currently under development and will be available in the system shortly. So let's have a look at some of the documents that I've called out in the previous slide, and we're going to actually have a look at what data actually looks like in those documents. And we're going to sort of frame this using an example of a person who has diabetes. So let's use Brian, for example. So Brian is a 62-year-old male who has hypertension and was diagnosed with type 2 diabetes almost 2 years ago. Brian has been managing his diabetes through dietary modifications and lifestyle changes, along with his prescribed medication. Brian regularly visits several healthcare professionals to help him manage his conditions. Now, Brian was home with his wife when he started to feel unwell and was going in and out of consciousness. So he was admitted and kept in hospital overnight for treatment to stabilize his condition and to ensure the management of his conditions were reviewed. So while Brian was in hospital, he actually had trouble recalling the names of his medication, including a medication that he was allergic to. So he notified staff at the hospital that he did have a My Health Record so they could access some information in there. Now, after being discharged from hospital, Brian went to visit his general practice and he explained to his healthcare team, so his nurses and his general practitioner, that he had been to hospital. So what information would the general practitioner or the nurse be searching for in the patient's My Health Record, or what typically would they be interested in seeing as a result of this health event that Brian has recently encountered? Having a think about what your practice would typically do workflow-wise to try and gain access to this information for a patient in this scenario. So let's have a look now at what some of these key documents are that can be accessed from a patient's My Health Record. So the first one that we're going to touch on is a shared health summary. So people with diabetes often have other conditions, and this can be really easily captured in this document. Now, a shared health summary may include information about an individual's medical history, including, medications that they're taking, allergies and adverse reactions, immunizations, as well as other diagnoses or procedures that they have. And this shared health summary document is specifically prepared and uploaded by the individual's nominated healthcare provider. So that can only be, or the person authorized to upload this document is a general practitioner, a registered nurse, or an Aboriginal and Torres Strait Islander health worker. But it must be the person's nominated healthcare provider, because we want an up-to-date, accurate reflection of the patient's health status in each of these 4 health areas. So we can see here there's adverse reactions, list of current medications, medical history, including procedures, as well as immunizations. And we can see all of the details about the uploading provider at the bottom of the screen here. So we can see the name and contact information for the general practitioner as well that uploaded this document. So the shared health summary can really help us, particularly if we're specialists or allied health providers seeing the patient maybe for the first time. Maybe we're waiting on a referral letter, or the referral letter doesn't have enough information or the kinds of information that we're looking for. The shared health summary might be a really great snapshot in time of where the patient is at health-wise. Now, hospitals do upload discharge summaries. We can see 99% of public hospitals across Australia are connected, and a lot of private hospitals also connected. So I think we're currently at around the 65% of private hospitals that are connected to the system. And the way that the hospital discharge summaries get uploaded is it's done automatically through the back end. So the hospital staff don't need to actively click on an upload button. When a hospital creates a discharge summary, it will be sent directly to the intended recipients as per current practices. But in many cases, a copy of that exact document will also be uploaded to the person's My Health record in the back end. Now, the information contained in the discharge summary can be shared between the individual's, general practitioner, the referring specialist, any allied health professionals that are engaged in the person's care, as well as community pharmacies. And all of these members of the patient's healthcare team that have access to the discharge summary can really support that continued care of the individual once they've been discharged from hospital. Now, medicines information can be really useful, particularly for supporting people with diabetes. And there can be a range of medicines data found in all sorts of documents in a patient's My Health record. So how do we reconcile that medicines data quickly and as accurately as possible using My Health record? We can do that using the medicines overview. So this document has been designed to support healthcare providers in accessing quick and comprehensive information about all the medicines data that has been shared to the patient's record. So we know that medicines information can be uploaded to a patient's record in a number of ways. So for example, a dispense record coming from pharmacy, prescription records coming from our prescribers, so our maybe general practitioners or specialists or nurse practitioners. We can see that MBS items and PBS items can also give us some medicines data. Shared health summaries can give us lists of medicines from the general practice. Discharge summaries from hospitals can also give us a great deal of useful medicines data. So how do we view that information all in one? We can use the medicines overview. So we can see here that by accessing the medicines overview document, we can see on the left-hand side the source and the author of this piece of medicines data. We can see the date it was uploaded. We can see the active ingredient, brand, and dose and directions, and all of this in one listed view. So we can get additional information that we might not have otherwise known about or might not have otherwise had access to, and this can help add to the information that we already know about our patients and support us in making better decisions about medications that are prescribed for people with diabetes. And we can also get information about whether patients are maybe having difficulty with getting medicines that have been prescribed and getting those dispensed. So it's a really useful way to help us in medicine information reconciliation. Now, Immunisation Consolidated View is a new enhancement. It is a recent addition to the My Health record, and this gives us an overview of the immunisations history of a patient. Now, this is pulling information directly from the Australian Immunisation Register record for the patient and into this view for us. So we can see at the top if there are any alerts or next due date for immunisations, and we can also see the history of immunisations for patients as well. So this can help provide clinicians who are involved in a person's care and provide them with an overview of their immunisation history and the status, because that can be particularly important for people living with diabetes, as they are at a greater risk of developing serious health complications from conditions like the flu or influenza than other people who do not have diabetes. So this can help clinicians prompt a discussion about flu vaccines or other vaccines, and provide protection to reduce the severity of those symptoms for people with diabetes. So having a look at another document that is of interest to a lot of people, and that's our pathology and diagnostic imaging. Many pathology and diagnostic imaging providers across the country are connected. If you're interested in knowing which pathology or diagnostic imaging providers in your regions are connected to My Health Record and sharing results, there's a link at the bottom of this screen which you can click on, which has a list of all of the pathology and diagnostic imaging providers, and whether or not they have requirements for uploading, or whether they will automatically share their results to My Health Record. So all of that can be found on that website. But here we can see the overview document, which gives us a list of the recent pathology and diagnostic imaging results that have been uploaded for the patient. So this one is specifically the pathology overview. So the diagnostic imaging results will be in a separate document. But here we can see a range of different organizations have shared pathology results. We can see, Bay Hill Pathology as well as Westmead Pathology. And so often patients who don't remember where they had a collection done, this can be really useful in us chasing up those results. We can download and save those reports directly from the patient's My Health Record. And of course, this is specifically relevant to people living with diabetes, because we know when blood glucose levels have been too high for extended periods, this can lead to complications. And effective diabetes management happens when people are involved in the management of their condition. And so not only can clinicians view this information, but patients can also go back and have a look at their results as well, if they would like to, and track their progress. So also important to note here that pathology and diagnostic imaging results that are shared to a patient's My Health Record have a 7-day delay. That means any results that go up into a patient's record can't be viewed by the patient for 7 days, and that's to allow the healthcare professional to contact patients with their results and follow up if it's a clinically significant result, and ensure that that's interpreted appropriately before the patient has access to it. The only exception to that is the COVID-19 results, where that can be accessed immediately by the patient when it's uploaded to the record. Now, Medicare can be a really useful source of information, because, managing diabetes requires a range of different health checks, in which case the Medicare overview can be helpful. This overview can be used to check, that our patients are up to date with annual, podiatrist checkups, or, other checkups such as, optometry appointments, or if we're concerned about things like gum disease, also important to see if they've had any recent dental visits and things like that. So we can have a look and see, what other healthcare services our patient is accessing. It can help us support the patient by suggesting or prompting them to access specific services. And we can also see what other members make up part of that patient's healthcare team. So here we can see the service provider that provided this particular service to the patient. So we can also improve our coordination and collaboration with other members of the patient's healthcare team by accessing our MBS data in patients' My Health Records. So to conclude, how did My Health Record help Brian and his healthcare team? The GP and nurse were able to access Brian's My Health Record to view information about what had happened to him in hospital. The healthcare team could view the discharge summary, and they were easily able to access details of the newly prescribed medications and could confirm in the prescription and dispense view that it was actually dispensed to the patient. The GP then uploaded a new shared health summary to reflect the changes to the patient's health status, and that could also benefit other members of the patient's healthcare team who would be supporting Brian in the near future. We could see that the practice was able to access timely information that was really helpful to the healthcare professionals in making suggestions and clinical decisions about Brian's care and the best treatment plans for him moving forward. The clinician did not have to order any additional blood tests because they could actually see the recent pathology results that were done in hospital. So we were able to avoid that duplication of testing. And then they decided to complete a team care arrangement and referred Brian to a dietitian in order to review his nutrition and dietary plan. So this is just one example of how access to My Health Record can save a lot of time and support in that better management of care for patients. Overall, we've seen My Health Record can support the overall health sector through the improved continuity of care and reducing that duplication and wasting of resources. It's able to support healthcare organizations because it can reduce your time in gathering information and improve your decision making, and also helps patients manage their health better, which will all lead to improvements in patient outcomes. So that is the purpose of the system. Now, I might just quickly pause here before I jump into access security and consumer control and have a look at some of the questions coming through and perhaps answer a couple of them. So I can see here, if someone's elected not to have a My Health Record and changes their mind, what would the process look like? So absolutely a good question. There was an opt-out period in 2018. So that meant that any Australian who did not opt out would have had a My Health Record created for them. And that's how we've ended up with 23.3 million My Health Records. So 9 out of 10 people already have one. And if at a later date they decided, I want to cancel my registration for my Health Record, they can absolutely do that through their MyGov account. So My Health Record is managed by patients through their MyGov account. People can also choose to restrict their record. So I won't go into that into too much detail because I'm about to touch on that in the next couple of slides, but there are ways that people can manage the information in their record and restrict access if they would like to do that. But of course, if somebody has a My Health Record at the moment and they choose to remove their registration or cancel their record, they can absolutely do that through their MyGov account. So I hope that answers your question. Oh, sorry, I've just reread that, and you're asking if they've elected to not have one and now they would like one, what can they do? It's very easy to register for a My Health Record. It used to be not so easy, but this process is streamlined. So if somebody who opted out in 2018 has now said, hey, I actually do want one, it's all the information is on the My Health Record website. So if you go to myhealthrecord.gov.au, there is a step-by-step guide on how to register for My Health Record, and it is a much more streamlined process than it used to be. So yes, again, let me know if you have any follow-up questions to that one. Can data from my health record, example, medication path results, be imported into a practice's electronic medical record? Yes, it absolutely can. A little bit later on in the presentation, I'm going to provide you with some links to some software-specific demonstration training where we go into specific software products and show how to actually use my health record in a patient clinical file and how easy it is to open up a record from that clinical system, view the information and download it into your own software product. So absolutely, that is a key function of the system. And I encourage you to keep an eye out a little bit later on in the presentation. And if you use one of the conformance software products where we offer a live demonstration, to register for that training, because that can be really useful and sort of change many clinicians' perceptions on the value of my health record, because you're able to actually see practically what that looks like in your specific software product and how easy it can be to utilize. We've come a long way in the software functionality. Previously, there were some sort of, issues with, depending on which software you used and how well the functionality had been built, it could be a bit clunky in some cases. But a lot of software vendors have been improving their functionality through to My Health Record over time. So, for example, many software products that are used across the system. So if we're using primary care as an example, Medical Director, Best Practice, Genie, Communicare, ZMed, these are all software products that have enhanced their functionality and the way in which My Health Record is used in their system. So I'd encourage you to have a look at that training when it comes up. In general practice, I find medication information is inaccurate. Will this be uploaded? So absolutely a really good question. And again, I point you back to the training on uploading because we do have a lot of training and education that we do with healthcare providers around data quality. Data quality, of course, is a very important component to this system working well. And absolutely, there is a great deal of resources and support to ensure that clinicians are understanding that the flow-on effects of the quality of the data in their clinical software. But to answer your question in a short sense, before a shared health summary is uploaded by a general practice, there is a template or review process. So they click on upload and then they have to review the information within that template, which is pulled. So the data is populated from their clinical file. So absolutely, if there was incorrect data, it would be populated through, but the clinician has the opportunity to untick or remove or update information before they click on the upload button. So the process is designed to enhance the quality of the data as best as it can, so that clinicians, particularly general practices, are able to upload the most accurate information, particularly around medicines. I know, of course, from my experience working in general practice, we can often have a backlog of lots of medications listed in there that the patient's no longer taking, such as, short-term antibiotics and things like that. And that's not a good reflection of what the patient is currently taking. So we absolutely have a process for when a shared health summary is uploaded on how to review and upload the most accurate information. So I think Allied Health can already upload if you have a compatible medical record. And I think that's in response to a question about, can Allied Health share information? There is a document called the event summary. That document can be uploaded by any member of the patient's healthcare team. So that's a really useful document for Allied Health professionals. If you see a patient for, a podiatry appointment, for example, and you'd like to share information about that appointment to the patient's My Health Record, you can absolutely do that through the event summary. However, you need to have a conformant clinical software. So because of the security of the system, we have to ensure that people accessing and sharing information to My Health Record are authorized providers. And in order to do that, you must be using a authorized clinical software that is approved to connect through and share information to the system. So I will touch on software products in just a moment when it comes to accessing My Health Record, but allied health providers who use a conformance software can upload. But if you don't have a conformance software, or the software product that you use is not yet offering that functionality to My Health Record, then I'd encourage you to access My Health Record through the National Provider Portal, which basically is an online web browser. However, you won't have the ability to upload information. You'll be able to view patient's My Health Record and get the benefit of accessing information from other members of the patient's healthcare team, but you won't be able to share information until you have a conformance software. So I'll touch on software a little bit more in just a moment. So I think that's a good sort of time spent answering a couple of questions. I might just quickly go back to our content to finish up our information that we're going to pass on through our slides, and then come back to any questions I might have missed. So how does My Health Record work? This sort of comes back to our conversation around whether or not you have a conformant software. So just touching on consumers and carers, on the right-hand side, we can see our green diagram. Access to My Health Record as individuals is all done through MyGov. So we can upload and share information to our own My Health Records through MyGov, and we can also view it. There are a number of authorized apps that also allow patients to have My Health Record in their pocket, so accessible through their mobile devices. However, you can't upload as yet on those authorized apps. You can simply view your My Health Record, which can be really beneficial for patient self-management, particularly with people who have chronic and complex conditions, and people who may need better access to their health information. Now, providers access it in one of two ways. As we mentioned, the first way and the most preferable way is through a conformant software product. So I mentioned a few of them already. So for example, Medical Director, Best Practice, Genie, ZMed, Communicare. These are some examples of some general practice or primary care softwares. There's also a lot of specialist softwares that are coming on board as we get more and more specialists connected. So Clinic to Cloud, software for specialists, Genie Gen 2, and a range of others. And there are a range of allied health provider software products that are available. So accessing it through a software product will give you direct access to My Health Record through your patient's clinical file. So if we've opened up Brian's clinical record in Best Practice, for example, we can see all of our practice data for that patient, and we'll also be able to see a My Health Record button on that patient's clinical file that we can click on, and it will give us direct access to the patient's My Health Record, so we can view and upload and share information through our clinical software. Now, if we don't have a clinical software and we would still like to view My Health Record, there is the ability to do that through the National Provider Portal, which is essentially our online browser, and that uses our PRODA login. So if you're somebody that has a PRODA account to access HPOS or other government services as a healthcare provider, then you've already done part of the process, but then you would just need to get registered for the system to use your National Provider Portal access point, which can be really beneficial in particularly the allied health space. Now, here's a demonstration or a bit of a snip of each of these sort of methods. So here we can see the conformant software. So we've opened up, this is the Medical Director, and apologies, it's a little bit blurry there, but essentially you can see here the patient's My Health Record has been opened directly from their Medical Director clinical file. And then we've got the National Provider Portal where we've logged in using our PRODA account. And this might be a really great way to view all of this useful clinical information as a healthcare provider who doesn't have a conformant software. Now, how do we know about conformant software and whether or not we have one, or what softwares are offering this functionality? I'd encourage you to click on the link at the bottom of this slide. Again, all the slides will be shared, and this is giving you a list of all of the software products that are currently offering that functionality through to My Health Record. And the version numbers as well. So if you maybe just need to update your version number, as this is something that a lot of software products are starting to introduce in later versions. Now, having a look at the authority to access. So sometimes we get this question, if I can register and use My Health Record for any patient, what does that look like? So important to note that providers are under no legal obligation to use the system. It is up to your clinical discretion as to whether or not you access it, but it is there as an additional complementary tool that you can access at any time if you see fit. So we're not expecting providers to access My Health Record for every single patient, every single day. It is up to your clinical discretion as to when it is appropriate to access My Health Record and when you think it might be useful to look for additional information in the patient's record. So this might be a prompt from the patient saying they've come from hospital. This might be a new patient you're seeing for the first time. This might be if you're sharing information. So there are a range of different scenarios when you might choose it to be appropriate, and this is when we would encourage you to use the system. Authority to view, all healthcare providers are supported by the legislation to view a patient's My Health Record at any time without needing to ask permission. So you don't need to ask permission or gain consent at any time. The legislation supports you to view My Health Record in the same way that you view your local clinical file on a day-to-day basis. The only requirement is that you must be an authorized user of the system. So your organization must have authorized you to use the system, and you must be accessing My Health Record for the provision of healthcare delivery. So you must be doing it in order to provide healthcare to the patient. You cannot view My Health Record for any other purpose. So as long as you're doing it for that reason, you absolutely do not need to interrupt your workflow by asking patient permission or anything like that. It is designed to be part of your regular workflow.
I'm just mindful that it's now 1:15.
Thanks, Raina. I've come to the end of the content, so I might just leave it there and hand over to you. But there's some information here on patient control, which I'll leave in the slides for anyone. And I saw a question come through about where we can get support. So these slides here will answer that. So anyone who needs support for either getting connected to My Health Record or, getting set up to use the system in your practice, please reach out to us at the connections@digitalhealth.gov.au. Again, all of these slides will be shared with everybody. You can also contact your local primary health network, which is a great source of free support ongoingly. We have a great deal of online learning modules and our upcoming virtual classroom sessions. So these are those practical live demonstrations that I was talking about earlier. There's some support there for using both the national provider portal if you don't have a conformance software, as well as conformance softwares there as well. So again, all of these will be supplied after the session.
Thank you so much, Brianna. I'm so sorry we squeezed in a lot in a short period of time. But before we all go, we just wondered whether you wouldn't mind answering this poll just around whether you intend to take any action following the session today with Brianna, with the questions are getting connected and start using the My Health Record, start using the My Health Record more, access further resources and training, no action, or not sure or not applicable. And I'll give you a few, give you 10 more seconds to kind of answer. And so what I'll do, so that looks like 22% would get connected, or 19% start using My Health Record more. It's moving to, oh gosh, it's still moving. I'll give you another 5 seconds. I'll give you another 5 seconds. I'm going to cut it off into 1 now. And so, yep, so it's 12% would get connected and start using it, 12% would use it more, 45% would access further research, resources and training, 3% no action, and 27% not sure or not applicable. Thank you all. I'd just like to say about the next webinar on the 23rd of June, we'll follow the theme of supporting the interprofessional collaborative person-centred care, again using digital technology. The title will be Revolutionising Multidisciplinary Care, Is It Possible in the Digital Age?, presented by Dr. Jim Glasspool, and he'll share the literature on electronic sharing platforms to support complex conditions such as diabetes management, and then the reality of how using such a platform works in primary care, and it'll be sponsored by Precedence Healthcare. Thank you so much for joining us, and thank you, Brianna, for providing such comprehensive information, and we'll be sharing the slides with you all later as well as the recording. And thank you all, and have a good afternoon.
Thanks
Bye-bye.
for having me.